The World Health Organization has reported that 35% of the country's hospitals are out of service. Fighting makes it impossible to undertake the normal vaccination programs. The displaced refugees may also pose a disease risk to countries to which they have fled. 400,000 civilians were isolated by the siege of eastern Ghouta from April 2013 to April 2018, resulting in acutely malnourished children according to the United Nations Special Advisor, Jen Eglon, who urged the parties for medical evacuations. 55,000 civilians are also isolated in the Rukban refugee camp between Syria and Jordan, where humanitarian relief access is difficult due to the harsh desert conditions. Humanitarian aid reaches the camp only sporadically, sometimes taking 3 months between shipments. Formerly rare infectious diseases have spread in rebel-held areas brought on by poor sanitation and deteriorating living conditions. The diseases have primarily affected children. These include measles, typhoid, hepatitis, dysentery, tuberculosis, diphtheria, whooping cough and the disfiguring skin disease leishmaniasis. Of particular concern is the contagious and crippling poliomyelitis. As of late 2013, doctors and international public health agencies have reported more than 90 cases. Critics of the government complain that, even before the uprising, it contributed to the spread of disease by purposefully restricting access to vaccination, sanitation and access to hygienic water in areas considered politically unsympathetic. In June 2020, the United Nations reported that after more than 9 years of war, Syria was falling into an even deeper crisis and economic deterioration as a result of the coronavirus pandemic. As of June 26, a total of 248 people were infected by COVID-19, out of which 9 people lost their lives. Restrictions on the importation of medical supplies, limited access to essential equipment, reduced outside support and ongoing attacks on medical facilities left Syria's health infrastructure in peril, and unable to meet the needs of its population. Syrian communities were additionally facing an unprecedented levels of hunger crisis.